In this discussion, we're going to talk about diabetes, a little bit about what it is, peripheral neuropathy, and how to conduct a diabetic foot monofilament test. Specific to diabetes, there are over an estimated 34 million Americans that have diabetes. But of that, an estimated 7 million are currently undiagnosed. When you look at the incidence, there's about 1.5 million new cases of diabetes diagnosed each year. And the vast majority of diabetics, about 90 to 95%, have type 2 diabetes. Type 2 diabetes, and in fact all diabetes, is a disease that occurs when the amount of blood sugar or glucose in your blood is excessively high. In this state, it can do various types of damages to tissues. Blood glucose is the body's primary energy source, and we get our blood glucose primarily from the foods that we eat. And when we consume the foods, our pancreas produces insulin, a hormone, that helps move the blood glucose into the circulatory system and there into cells to be used as energy. With type 2 diabetics, they either do not produce enough insulin or their body organs and tissues are resistant to its effect. And therefore, the blood glucose stays in the blood and is not able to reach the cells. And again, in an elevated state, it can cause damage to cells and tissues. When you look at the various risk factors for developing type 2 diabetes, you've got the family history that can increase your likelihood of developing diabetes. Overweight and physically inactive. Those are the two main lifestyle factors that contribute to a higher risk of developing type 2 diabetes. It is more common in certain peoples, such as the African American, Hispanic, and Latino populations, the American Indian, Asian American, and those of the islands, the Pacific Islanders. There is a correlation between long-term hypertensive condition and a greater risk of developing diabetes. If during pregnancy a woman experienced gestational diabetes, she will be at an increased risk to develop type 2 later on in life. And if you are developed or developing a condition called insulin resistance. Now, when you look at the two very potent disease mechanisms caused by type 2 diabetes that can lead to a significant number of health conditions and diseases, you have to look at atherosclerosis and nerve damage. Atherosclerosis is a type of cardiovascular disease that is characterized by the progressive narrowing and hardening of the artery due to the buildup of plaque. That condition itself there's multi-factors and mechanisms occurring to lead to atherosclerosis, and high blood sugar and its impact on endothelial cells and platelets and so forth increases the likelihood of atherosclerosis, which of course is going to reduce blood flow to an area that the artery feeds. Also, a high concentration of glucose in the blood is associated with damage to nerves throughout the body. And when we talk about peripheral neuropathy, then of course that is specific to the legs and feet. Now, when you consider the health conditions and diseases that people with diabetes develop, you certainly have a much greater risk for heart disease and stroke. The arteries that feed the heart and the brain become narrowed due to the buildup of plaque. which again is a high blood level of glucose is associated with that. Eye disease and kidney disease due to the arteries that feed those organs. Peripheral neuropathy, which we're going to talk more about. Sexual problems, both the vasculature and the neural stimulation of genitalia and those organs there, and bladder problems. So what is peripheral neuropathy? Peripheral neuropathy is a condition that causes damage to peripheral nerves that can lead to an altered sensation in the skin. Now, this can come in various forms: tingling, numbness, pain. You can even experience a kind of crawling sensation, like something's crawling under your skin. And it can lead to a loss of protective sensation. Now, in our skin, we have several proprioreceptors that, when stimulated, send a message to the brain. And at the brain, we interpret that as, it could be temperature, hot and cold, touch, pressure, vibration, and so forth. Whatever proprioreceptors were activated. Specific to those in the skin and related to, like touch and pressure and pain, a loss of protective sensation inhibits or prevents these nerve transmissions so that a person, they can't detect, they can't really feel an injury or compromise to the skin. Whether that be a nick, a very minor nick to the skin, a cut, a blister, even a hot spot that could lead to a blister, a wart, even a callus, anything that can compromise the skin. Now, when you consider this combination of peripheral neuropathy and atherosclerosis, with peripheral neuropathy, when you've lost this protective sensation, if areas of skin that are on the plantar surface of your foot, if they have lost the ability to detect that injury or that something has happened, the skin has been compromised in some way, then any of these lesions literally will go undetected, and could go for a long period of time if you're not looking for it. Plus, in these already damaged tissues, atherosclerosis, again, a disease that can be exacerbated by type 2 diabetes, reduces the blood flow to the arteries and arterioles that supply the oxygen and nutrients, in this case, as we're talking about peripheral neuropathy of the foot. And that can even make the slightest lesion to the skin prone to infection and can lead to a very difficulty in healing, which could lead to an ulceration and the possibility of amputation of that part of the limb. When you look at the areas on the foot that are at greater risk for peripheral neuropathy to occur and the associated potential infection and ulceration, we have the weight-bearing pressure points that are on the plantar surface of the feet. We find them in the heel, the heads of the metatarsal bones, the distal phalanx of the toes, and again, these are on the plantar surface of the foot. But we also can have pressure points on the top of the foot and the top of the toes, especially when certain musculoskeletal deviations or conditions exist, such as a claw toe or a hammer toe, and some of those can be even made worse if you have a pes cavus or a high arch, and therefore would rub against the top of any kind of footwear. Which leads us to the diabetic foot monofilament test, or screen, again, for any kind of loss of protective sensation. Now, there are different types or protocols of monofilament tests, but they are designed to assess if there is a loss of protective sensation, specifically to the high-risk areas of the foot, uh, for the purpose of developing, if we can identify this, then intervention strategies can be developed, put in place to slow the progression of the peripheral neuropathy and to protect against the consequences, the complications of that neuropathy. One of the more common monofilament tests is the 10-site approach, where on the plantar surface of the foot, you would apply the monofilament, that single nylon strand that is designed to buckle at a certain amount of pressure, stress applied to it, and which we should all feel. So on the 10-site approach, on the plantar surface of the foot, as you can see with these red dots here, where you would apply the monofilament thread to the plantar surface of the big toe, the third toe, and the fifth toe, and also to the heads of the first, third, and fifth metatarsals. Also down here on the heel, and then on the medial and lateral borders of the foot. And then, of course, one point site is tested on the top of the foot at around the base of the first metatarsal bone. So, how to conduct a diabetic foot monofilament test? Prior to the test, to help you get prepared to actually administer the test, it's important to practice proper hygiene when dealing with touching another individual. Wash your hands prior to administering the test. You will take this time to instruct the patient to move their shoes and socks, and then position them sitting on the end of a table with their feet hanging over the end of the table. And at this point, we want them upright, because then you're going to explain to the patient the test that they're going to undergo, so that they can understand the what and why of the monofilament test, which basically is to determine, is there a loss of protective sensation? You're going to demonstrate the test by applying the monofilament strand perpendicular to the patient's palm, finger, and arm. Now, we're talking about a test to the foot, but we're going to start by applying the test to the palm of their hand, the fingers, at the distal end of their fingers, or somewhere on the arm, in a similar manner in which you will later conduct it on the foot. The purpose for this is so that they can see, this is not painful, and it gives them an idea of what to expect, what the test will be like when administered to the foot. At this point, you're going to instruct the patient to lie down on the table and to avoid watching the test that you're going to conduct. Because a monofilament test is a test for sensory perception of the skin, not a test of visual feedback. So again, they cannot be looking at the test. And then as you apply the monofilament strand to these various points that we've identified, you'll instruct the patient to respond with a verbal yes, or it could be having them raise their hand when they feel the monofilament being pressed against their foot. Okay. So again, here we see the locations on the respective feet, because you will want to conduct this on both feet. And you can see that we have a reference there to a diabetic neuropathy monofilament screen, foot screen. We'll show you later on how to access that. But these are the places in which you apply the monofilament to conduct the test. Okay, so you can see with this illustration to the bottom right of the slide, you see that very small monofilament strand that sticks out from the applicator there, applying it perpendicular to the skin. And you conduct the test with really 3 steps. The first is to touch the skin with the monofilament strand. Then smoothly apply sufficient force to cause the strand to bend into a curve. That curve is going to be about 1 centimeter. And this is the amount of, when it will buckle at a force of about 10 grams when you're using a 5.07 gauge monofilament strand. And you hold that position with the monofilament bent for about 1.5 to 1 second. And then you lift the monofilament strand away from the skin and you have completed the test. Again, you see here down at the on the bottom here, ProHealthcareProducts.com does sell a variety of monofilament tests for you to choose from. Okay, so when you're conducting the test and you want to document your results, you will actually document it on that diagram of the foot with the red circles, and you're going to place a positive in the site circle. All of those where they could respond, they could feel it, and responded with a yes, you put a plus. If there was a site where they could not feel the monofilament strand, then you would mark a negative in that site. In fact, we put together a diabetic neuropathy monofilament foot screen form that you can access right there. Now, just a couple last points here specific to the test. When conducting the test, the pace at which you move from one site to the other should vary so that the patient doesn't kind of get into a rhythm or a cadence and would anticipate when the next test is being conducted, which could give you, some false information. Also, when you test, you should move randomly from site to site. Or in other words, you don't just go big toe, third toe, little toe, and gradually work your way down the foot, but you want to randomly move around a little bit, again, so they don't recognize and anticipate the pattern, which could influence their response. When you're actually conducting the test and you have a place where the patient does not respond at a specific site, they did not fill the monofilament test, don't stop there. Just continue on to the next site and the next site. Do that uninterrupted. At the conclusion of your testing, when you've done all 10 sites, repeat the test at the site or sites where the patient did not respond. Okay, they didn't respond at all, but we want to again test it and document accordingly. And then, as I mentioned previously, always conduct the test on both feet. Now, so that completes how we do the test. Just one kind of final word about peripheral neuropathy. You see this comes from the Annals of Internal Medicine. Specifically, you can see the information there on how you could access that. But the title of the article was Peripheral Neuropathy Associated with Increased Mortality Risk, Irrespective of Diabetes Status. So I've taken from that really interesting study a few key bullet points, quotes taken right from the article. I'm going to read the first one. Patients with both diabetes and peripheral neuropathy had the highest risk of death during the study's 13-year follow-up. But here's the important thing. But the next highest rate was in patients with peripheral neuropathy, but who did not have diabetes, then followed by those with diabetes without peripheral neuropathy. Okay, so that's related to death. As you can kind of see then on this next quote, it says, our study contributes to the growing body of literature supporting the concept that peripheral neuropathy is associated with substantial clinical sequelae, which is kind of a second result or after effect of a disease going on, and that prevalence of peripheral neuropathy among adults without diabetes is substantial, and the peripheral neuropathy may be an unrecognized risk factor for death. In other words, the in the past and currently really, monofilament testing has primarily been just conducted on individuals with diabetes because of the associated risk for peripheral neuropathy. This study may suggest, however, that a much broader population that should be undergoing monofilament treatment beyond just the diabetic community, testing them also for a loss of peripheral sensation. And then furthering the case for monofilament testing, they concludes with this statement in the article. Monofilament testing at the foot is a quick clinical screen for decreased lower extremity sensation that likely is a result of sensory peripheral nerve decline, which of course is a loss of protective sensation. And that concludes the PowerPoint on diabetes, peripheral neuropathy, and how to conduct a monofilament foot screen